down a rough patch of road.
The health insurance industry has had 70 years to shape up. Ever since President Harry Truman proposed universal health care, full Medicare for all, in the 1940s, the health insurance industry has dramatically expanded its selectivity of customers. It has shown that it has a perverse incentive by making more profit in accordance with how many claims they deny, how many customers they exclude, and how much they can overcharge people without very much attention at all about prevention or cost control.
My name is Stephanie. My husband and I drove here today from the Ithaca area. I'm a student, and I'm a wife, and I'm a personal trainer, and I'm uninsured, and I have a kidney disease. Since 2004, I've navigated my way through this convoluted healthcare system, trying to get the basic things that I need to ensure that I'll continue to live, which is what it comes down to.
Now, another big debate in the United States over health insurance reform, which is not health care. And we see a majority of the people wanting single payer, full Medicare for all. They see how it operates for elderly people. The majority of doctors and nurses are for single payer Medicare for all, free choice of doctor and hospital. And it's off the table in Washington.
Committee will stand in recess until the police can restore order.
Florence Nightingale said, "Were there none that ever hoped for better, there would never be any better. Until there's a single-payer healthcare system in this country, there will never be safety."
The Democrats and Republicans and President Obama pushed it off the table. In this famous roundtable that occurred in February 2010 at Blair House opposite the White House, there were almost 50 members of Congress from both parties with President Barack Obama on national television. Not one member of Congress was invited who supports single-payer health insurance, the majority position in this country.
I was insured for a while when I first became ill, and it was really lucky for me because I had a lot of tests, and luckily we were able to figure out what I have.
We now have 3 good studies showing how many lives are lost every year because people can't afford health insurance to get diagnosis and treatment in time. The Urban Institute comes in at 18,000 deaths a year. Families USA comes in at 27,000 preventable deaths a year because they can't afford health insurance. And the Harvard researchers with peer-reviewed report in the Journal of Public Health come in at 45,000 Americans every year who die because they can't afford health insurance. In Western Europe and Canada, nobody dies because they can't afford health insurance. They are insured from the day they're born. In Western Europe and Canada, you have everybody covered at a dramatically lower price per capita than what we spend in our wasteful, corrupt, inefficient system.
But I guess I'm just standing in front of you today to say that I am uninsured. I am a contributor to this society. I'm a student. I'm trying to do my best. I try and stay healthy, and it's not enough. It's not enough for me to do my best. I need health care. I need to see doctors. My health care is rationed. There are tests that are not ordered, and there are specialists that I don't see. And I find myself a lot of times standing on a ledge wondering what's on the other side and wondering about my health in all, even though I try to keep myself well.
We spend now, as a nation, about $7,500 per person per year, on the average, for health care, even though 50 million people almost are not covered at all, even though there are tens of millions of people who are underinsured and don't have sufficient coverage. In Canada, Switzerland, Germany, France, it comes in at about $3,500 to $4,000 per capita. They cover everybody for almost half the price. So it's time now for a grassroots movement spearheaded by groups like the Physicians for a National Health Plan out of Chicago, where almost 20,000 physicians have signed on for the single-payer full Medicare for all with free choice of doctor and hospital, which tens of millions of Americans don't have now under HMO plans.
It's a sense of outrage that brings me to the Senate table.
You've been entrusted in doing the people's work, and yet you...
Committee will stand recessed until the police can restore order.
The insurance companies, the hospitals for profit. And the more aggressive newcomer to the single-payer advocacy, which is singlepayeraction.org.
This just isn't right. I shouldn't be left out of the dark. I'm not a bad person. I didn't do anything to deserve this disease. It was just bad luck, I suppose. So I guess I'm just here today to say that humanity cannot afford to continue private coverage for people. This is the civil rights movement of our generation, and for-profit industry has no place in a just healthcare system. Thank you for hearing me. Single payer now. That's singlepayeraction.org. The legislation that will eventually pass in 2010, probably in Washington, D.C., will be a sliver of what even President Obama sponsored, which was not single payer. It is being driven down to a few shreds of modification of the health insurance policy, such as preventing you being denied health insurance because you have a pre-existing condition. That's important, but a tiny step to the comprehensive reform for quality control, cost control, universal coverage, and an emphasis on prevention of disease and trauma, called full Medicare for all, with free choice of doctor and hospital. That's what this country wants, and that's what the people of this country can get if they have their own self-respect as strong civic advocates to turn the corporate power system that dominates Washington and congressional policy around so that the economy of health insurance serves the people rather than the people having to suffer a pay or die system, unlike any of that in the Western world and some third world countries as well that have moved to the single payer system. Thank you.
Got one shot to do this. Gotta do this right. Might be tomorrow, might even be tonight, but you can bet your life what you do comes back to you. And you can bet your life what you've done is coming for you. And you can bet your life they can look but they won't find you. You can bet your life they can look but they won't find you. 'Cause you're gone, let it gone, yeah. Let it gone, yeah.
False media, we don't need it, do we?
We have to fight